Welcome to the Osteo and Physio YouTube channel. For today's video we are going to be looking at cervical spondylosis and we'll be adding on to our neck and headache series. Cervical spondylosis is defined as degeneration of the neck or osteoarthritis. The most common structures that are involved with this particular condition are the intervertebral discs, the vertebral bodies, the transverse processes and the spinous processes, as well as the facet joints. So what that means is all of the surrounding structures that are involved in movement and support of the neck. What we also find is a lot of tightness and stiffness coming down into the neck muscles as well as around the base of the head. So the most common symptoms that people present with is restriction, pain on movement, tension around the neck, as well as and sometimes associated headaches. The first thing that is absolutely key is daily mobility. When we have wear or tear or stiffness within a joint, what we need to do is continue to get lubrication of the joint surfaces. How we achieve that is through movement. So the main vector of movement I would want to integrate in the neck are flexion, extension, rotation. So how we do this is nice and relaxed position. You're going to gently drop chin down towards the chest. Good. And then looking up towards the ceiling. What you'll probably find, depending on the amount of severity or the amount of pain that you're getting with this particular condition, is that you will have to reduce your range of motion and how fast you go through each movement. So it needs to be slow and controlled. I would start off integrating this in the morning and the evening, as they're normally the peaks of stiffness with this specific condition. So you want to aim between 5 to 10 reps in each direction. So side to side, looking down, and then looking up. The second thing you can start to do is release around the muscles around this area that are really tight and holding. So what you can do with the hands is just make circular motion around the muscles. So you can start at the base of the head and then start to move the hands down as if you're moving down towards the collarbone. So you're starting around the back of the neck, massaging through, and then you can come a little bit more around the front. So the idea is that you get the whole of the neck complex. There's no set of time at which you can do this for. It's just a really nice way to release through. If this feels uncomfortable, another thing that you can do is actually add heat into the neck by adding something that you can put in the microwave, like a wheat bag or a hot water bottle. What this does, it starts to release the muscles, so the paraspinal muscles and the trapezius and the scalenes and all the muscles that surround the neck. It gets them to start to relax through, which means that you haven't got that tension. You can start to regain movement. Once you have moved and you've relaxed through the muscles, you can then start to stretch. And again, this has to be that gradual progression in terms of stretching. You don't want to force it into a stretch position because you don't want to aggravate or cause more pain. So we can start off by stretching down into this side, so through levator scapulae, through the scalenes, through the traps on this part of the neck. And so how we do this is gently turn the head, dropping chin down towards the chest, so you'll feel it possibly stretching already. To exaggerate the stretch, you want to hold behind the head and then gently push the chin down towards the shoulder. So you're letting that relax there. Again, you don't want to force it. If it's really sore, just take it to there. You don't have to drop the chin all the way down because you can build this up over time. Same the opposite way. You can turn the head, chin down towards the chest. So again, if you already feel like that's stretching, leave it there. If you can push it a little bit further within a pain-free range and feel more of a stretch, you can use this hand to pull the stretch through. So again, with all the stretches, aiming between 10 to 15 seconds. Good. And then coming back up and then relaxing. The final thing that I would want to integrate, and this is outside the treatment room, so cannot stress that enough. If you're really suffering, go and get it assessed properly and go and have treatment. But for stuff that you can do at home, I would also continue that massage we looked at earlier around into the front of the face and up into the head, because like I said, with cervical spondylosis, we're kind of doing this through the neck. It causes a lot of tension up through, particularly up through here, through the temporalis muscle and the masseter muscle. So same as before, circular motion around the front of the face. So you're massaging around the jaw And again, you'll probably feel it's quite tight through here. So, you know, you can do this for as long as you want. I normally say about, 30 seconds to a minute, depending obviously on how busy you are. And you want to just massage around. Lovely. And then moving up higher, so literally just around the sides, so into the temporals, up through here. And it feels really nice. If you're struggling with tension type headaches, with cervical spondylosis, it's really nice just to release up through and then lift it up through, and again just relaxing through the whole area, because the aims of it is to keep it moving, to relax around and to take the pressure off around the neck and the head.